Michael, do you have examples of particular areas of science where an alternative can be used instead of an animal?
I'd like to begin by giving an example where the animal procedures cannot give the answers we need. Under the new EU system for chemicals, which is called the REACH system, the registration, evaluation and authorization of the use of chemicals, the chemical industry is going to have to evaluate the safety of tens of thousands of chemicals. The most controversial and the most expensive test, which may have to be performed on many of them, is the test for reproductive toxicity. This requires as many as 3,002 animals per substance, and the fact is it just doesn't work. The prevalence, that is the incidence among these chemicals of reproductive toxicity, is very low, and the tests used are very inaccurate. And if 1,000 chemicals are tested, there will be many false positive results, and among the positive results may be some true positive results. But at the end, because rabbits, which are used in the testing, are very different from humans, we don't actually know whether we've identified reproductive toxins or not. So this is an example where we just have to say, this doesn't work. We must find another way of getting this important information. But until then, the whole system is so entrenched, there's such conservatism in regulatory testing, that people insist on carrying on doing testing which can be shown, in fact, to be useless in terms of protecting humans.
John, you wanted to respond. Let John respond to that.
Example, the case of thalidomide, I know very little about toxicity, so I don't want to pontificate on it. In the case of thalidomide, the problem was that the tests were not done on animals, and that's why the tragedy occurred.
The past 40 years since the UK Medicines Act of 1968, the government has insisted that all new medicines should be tested on 2 species of animal, one rodent, such as mice or rats, and one non-rodent, such as dogs or monkeys, before they're tested in people for the first time in clinical trials. The Medicines Act was brought in as a response to a terrible tragedy that had been unfolding over the previous 10 years, and which was then the biggest drug disaster the world had ever witnessed. The name of the drug was thalidomide, and from 1957 to 1961, it was given to pregnant women in many countries to treat them for morning sickness. It was heavily promoted as a wonder drug and said to be completely safe, because in many tests in a wide variety of animals, it had caused no ill effects, even at huge doses. But in humans, it wasn't safe, particularly in pregnant women. It caused over 10,000 babies to be born with short arms or legs, or with no arms or legs at all.
I think that there should be tests to identify such dangerous drugs and chemicals. But which tests are up to the job?
I recently reviewed the success of tests that have been carried out for over 40 years since thalidomide to predict the potential of drugs and chemicals to cause birth defects in people. The results show that these tests, using animals as diverse as rats, dogs, cows and monkeys, agree with results in humans only around half of the time. We might as well have flipped a coin. I also reviewed studies that used in vitro or test tube-based methods and found that these are significantly better at predicting the response in humans, with up to 80% accuracy. So we do have superior methods, but our regulations are stuck in the past.
In this part of toxicity tests, we're going to look at reproductive and developmental toxicity. To begin, let's look at a definition of reproductive and developmental toxicity from the AllTox website. This slide reads, reproductive toxicity includes the toxic effects of a substance on the reproductive ability of an organism and the development of its offspring. Reproductive toxicity has been defined as any effect of chemicals that would interfere with reproductive ability or capacity, including effects on lactation. The definition of developmental toxicity is very broad, so the globally harmonized system considers the following definition sufficient for classification purposes. Adverse effects induced during pregnancy or as a result of parental exposure that can be manifested at any point in the lifespan of the organism. I'm just going to quickly look at 2 other slides from the AllTox website. This slide is on the animal tests. Animal tests include evaluating the effects of prenatal exposure on pregnant animals and their offspring. This test is usually performed with female rats and rabbits. The test substance is administered orally. The pregnant animals are killed just prior to delivery and the fetuses are examined for toxic effects. And so it goes on. You can read the rest of it yourself. This slide is about the validation and acceptance of non-animal alternative methods. It reads, the ECVAM Scientific Advisory Committee endorsed 3 in vitro methods for embryo toxicity testing as scientifically validated. One of them is called the embryonic stem cell test for embryo toxicity, and this, I have heard, is the best and most accurate test. The last paragraph is quite contentious. It reads, the ESAC, which is the European Centre for the Validation of Alternative Methods Scientific Advisory Committee, it recommends that these in vitro methods as ready for regulatory acceptance, but confusingly it says they cannot replace the animal test completely. They just say, however, when used as part of a testing strategy, they could contribute to reducing animal use. However, in this piece you will see that, and you have already heard that, there are a lot of scientists that question this statement. They would say that the in vitro models are ready to replace the animal tests right now.
Thalidomide is a drug that caused birth defects in humans in the late 50s and early 60s. And the drug caused the exact same birth defects in a particular rabbit. Now, some people would say that therefore the animal model predicted thalidomide would be dangerous. The problem with that is that there were over 100 species and strains of animals that were tested, and very, very few of them mimicked the human response. Over 90% of the animals tested did not suffer birth defects from thalidomide. So you really cannot say that the animal model per se is predictive. Neither can you say that the rabbit predicted the response. In order to say that the rabbit predicted this, you would have to see what the rabbit did when tested with other known teratogens, drugs that cause birth defects. Now, if the rabbit mimicked humans 9 out of 10 times, 19 out of 20 times, that's not bad. I would accept that as being a pretty good predictor. But in point of fact, rabbits are very, very poor predictors, and this is just an example where they happen to correlate with human data. Well, the reason that we know that rhino horn is not an aphrodisiac, aside from the fact that I took a whole lot of it in college, is because of the scientific method. Okay, the scientific method is the best method we have of understanding the material world. And we can do studies and we can actually find things out, and it's really neat. Now, teratogenicity is to see if drugs cause birth defects in humans. Teratogen means birth defects. And there are approximately 1,500 chemicals that cause birth defects in animals. Of those, only 40 have been shown to cause birth defects in humans. Now, we're going to use our little 2x2 table up here, and we're going to calculate the positive predictive value of animal tests for birth defects. And as you can see, it's about 3%. Not stellar. This is a study published in 1990 where 6 drugs that were in clinical trials were studied for their side effects, and then people retrospectively looked back at the animals that were tested to see how everybody compared. And what they found was that animals and humans shared 22 side effects, and we call those true positives. Animals incorrectly identified 48 side effects that in fact did not occur in humans, and the animals missed 20 side effects that in fact did occur in humans. Now, if we use our little box down here in the right hand corner, we're going to find that the sensitivity of that test is about the same as flipping a coin. and we're going to find that the positive predictive value of that test is 31%. Again, not a number that I would want to hang my life on.
Before we continue to look at other scientists who disagree on purely scientific grounds with using animals for testing and identifying human teratogens, let's first have a look at this slide. It's taken from page 288 of Dr. Ray Greek's new book, which is called Animal Models in Light of Evolution. The slide reads, Karnofsky's law states any substance can be teratogenetic if given to the right species at the right phase in development, in the right dose. That means all medications can cause birth defects in some species. An immense amount of experimentation has proven Karnofsky right. The unsolved problem here, as elsewhere, is that of which species and at what dose actually predicts human risk in advance of the emergence of human data. As we have seen here, and as we shall shortly see below, generating some developmental abnormality with a substance is fairly straightforward. Generating the one seen in humans is a different matter. I've only included this slide because you will hear pro-animal testers bend the truth by saying all or nearly all teratogens that cause birth defects in animals also cause birth defects in humans. Of course this is true if chemicals, drugs, are administered in extremely high doses at a particular stage in fetal development. Next I'm going to look at a few slides taken from Dr. Jarrod Bailey's paper called The Future of Teratology Research is in Vitro. It was co-written with A. Knight, Dr. Andrew Knight, and J. Balcom. The paper can be found on, well, one place the paper can be found is at www.aknight.info. That's at Andrew Knight's website. This first slide just shows that Dr. Jarrod Bailey is more than qualified to speak on teratogenicity. He did his PhD in viral genetics, and then he spent 7 years examining the causes of premature birth in humans, during which time he became increasingly aware of the lack of relevance of animal studies to human clinical progress. He's also a consultant to the Safer Medicines campaign. The following are slides of drugs that either cause birth defects in humans but not in other animals, or vice versa. This first slide reads, Insulin B is teratogenetic in rats, mice and rabbits. And at the bottom it reads, however, it is believed that insulin is not teratogenetic in humans. I decided it's going to take too long to go through every slide, so I'm just going to flash them up onto the screen and you can read them in your own time. So I'm just going to go right to the conclusion of what Dr. Jarrod Bailey says about the current use of animal tests to decipher what is and what is not teratogenetic to human beings. The list isn't comprehensive by any means. There's loads and loads of drugs and chemicals that Dr. Bailey has identified as being teratogenetic or non-teratogenetic to humans, but teratogenetic to animals. However, the ones that I've included here are the ones that I recognise and know myself. But if you want to go to the paper, the actual paper, you will see many, many more examples than the ones that are included here. Anyway, Dr. Jarrod Bailey's paper's conclusion, or at least part of its conclusion, reads, not only will the technology develop and the tests become more reliable, but the in vitro methods are already more reproducible, provide easier endpoints, present no problems with respect to route of exposure, placental transfer and metabolic differences, and are devoid of the plethora of confounding factors associated with the animal tests. Perhaps most importantly, the alternatives provide a means to establish vital mechanistic models of teratogenetic action and reduce the human impact of the false positive and false negative results generated by unreliable and confusing animal models. As human cell culture technology improves, particularly regarding stem cells, new methods will undoubtedly evolve that will enable a closer in vitro approximation of in vivo human teratogenesis. We believe the information presented here provides a scientific basis for teratology research to move away from the old, inconsistent, futile animal models through the adoption of now validated in vitro methods towards the development of new, cheaper, easier, more reliable, more predictive in vitro screening techniques. We are now going to look at Dr. Andrew Knight's paper called Systematic Reviews of Animal Experiments Demonstrate Poor Human Clinical and Toxicological Utility. Firstly though, let's hear from Dr. Ben Goldacre, who wrote Bad Science, who describes what systematic reviews are.
We'll have the news in a moment. First, as you know, all week here on PM and elsewhere on Radio 4, we're celebrating moments of genius, flashes of scientific brilliance through the ages. Tonight, the author of Bad Science, Ben Goldacre, chooses his moment.
The sheer quantity of medical research is overwhelming. There have been about 15 million academic articles published so far, and anybody who wants to be mischievous can go to this literature and pull out a few selective pieces of evidence to make their case. By picking out only the positive trials, for example, and ignoring the negative ones, you can make an ineffective drug look as if it works rather well. So while we obsessed in medicine over making our studies perfect and free from bias, at the crucial moment of synthesizing that data into a coherent story, we allowed bias to creep back in. My moment of genius, the idea of a systematic review of clinical evidence, put a stop to all this, and it's astonishingly new. In just 1987, Cynthia Mulrow showed that most reviews of medical research were utterly unsystematic, and in 1993, the basics of systematic review were bashed out at a meeting of the Cochrane Library, a body of academics which went on to advocate for these methods around the world. In a systematic review, instead of just mooching around online and picking out your favourite papers to back up your prejudices, you have an explicit search strategy for seeking out evidence. And you don't muck about. As well as randomised control trials, you look for études contrôlées et randomisées, controlliert und randomisiert, and the rest. You measure, without looking at the results, how good or bad the methods are. You give a critical, weighted summary of the findings, and you update it as new evidence comes along. It sounds obvious. But this careful analysis of information has revealed huge gaps in our knowledge. It's exposed that so-called best practices were sometimes murderously flawed, and by doing nothing more than sifting methodically through pre-existing data, it saved more lives than you could possibly imagine. As the great public health Dr. Muir Grace said, in the 19th century, we made great advances through the provision of clean, clear water. In the 21st century, we'll make the same advances with clean, clear information.
Ben Goldacre.
Prior to looking at Dr. Andrew Knight's paper on systematic reviews of animal experiments, let's first look at Dr. Andrew Knight on an Australian internet channel.
The three main areas of animal use in science are basic biomedical research, where people are trying to just develop new knowledge, expand the biomedical knowledge base. Secondarily, there's use of animals in toxicity testing, when new drugs and all manner of household products are tested on animals. And thirdly, there's use of animals in biomedical education, training of doctors, veterinarians, biologists, and even high school students using dissections and experiments on animals. Animal use has been dropping year by year until just a few years ago, when it's actually started to increase again. I work in London presently. In the UK at the present time, the numbers are now the highest that they have been for the last 13 years. In Australia, the numbers have also risen recently. The last recorded year was the 2003-04 financial year, and there were about 6 million animals used in experiments in Australia during that year. It's well understood that the reasons that companies conduct these experiments is because they're concerned about being sued by consumers in the future, because with every population of humans or other species, there's always going to be a few at each end that either are very sensitive to a new product or very resistant to having an adverse reaction. If a consumer does have an adverse reaction to a new shampoo or some other product and they sue the company needs to be able to say in court, we did all we reasonably could to assure the safety of that product. Only a very tiny proportion of animal experiments are actually used by a study that results in developing a cure for a human disease. The proportions are in the order of 0.3% of all the animal experiments actually end up being used in such a way. So that's actually an incredibly inefficient way of trying to develop cures for human diseases. Early versions of cell cultures were not particularly predictive of human outcomes, but very recent versions of cell cultures can be very predictive indeed, and more so than the commonly used mice and rats, for example, with respect to toxicity testing. So there are modernised cell cultures, there are computer simulations which are computerised databases which compare the chemical structure of a test compound with a whole range of structures in the database and predict biological outcomes based upon chemical structures. Much more consistent. Animal experiments tend to be very inconsistent. They're much more predictive of human outcomes. They're a heck of a lot quicker. A traditional rodent assay of carcinogenicity takes about 3 years to design, conduct and interpret, whereas a cell culture assay or a database predicting biological activity based upon chemical structure will take minutes to hours to days. They're much cheaper and they're much more accurate in terms of predicting human outcomes. It takes quite a long time for this information to trickle down through into all corners of the scientific community, and hopefully they'll be followed in time by increased government funding for the development of further alternative methods and centres for alternatives, increased awards for scientists who develop new innovative methods. We've just seen some of those given out recently at the national conferences here in Australia, but increased awards and career options available for scientists, and hopefully increased scrutiny of animal experiments being conducted in Australia.
So that was Dr. Andrew Knight speaking in Australia about animal experimentation. Before you can see the title of his research paper and where it was published. In this first slide you can see how Dr. Andrew Knight went about analysing the systematic reviews in the databases. This slide reads, bibliographic databases are constantly updated. 2,274 articles or reviews were retrieved by using the specified search terms on the 1st of March 2007. In total, 27 systematic reviews which examined the utility of animal experiments during the development of human clinical interventions. At this stage we're not that interested in that part of his research paper, but it goes on, or in deriving human toxicity classification. 7 systematic reviews were located, which we are interested in. What Dr. Andrew Knight found in his research can be summarised in the next 2 slides. This slide reads, however, most existing systematic reviews have demonstrated that animal experiments are insufficiently predictive of human outcomes to provide substantial benefits during the development of human clinical interventions, and this is the critical part, or in deriving human toxicity assessments. The next few lines don't really concern us here because we're interested in toxicity tests. And these 20 reviews are either talking about where animal models are used to mimic human diseases, or they're talking about basic research leading to medical breakthroughs, etc. So as we're only interested in toxicity tests, I'll go straight to the bottom last 4 lines. 7 additional reviews also failed to clearly demonstrate utility in predicting human toxicological outcomes, such as carcinogenicity and teratogenicity. Dr. Andrew Knight's conclusion echoes that of other scientific anti-vivisectionists. It reads, "The historical and contemporary paradigm that animal models are generally reasonably predictive of human outcomes provides the basis for their widespread use in toxicity testing and biomedical research aimed at preventing or developing cures for human diseases. However, their use persists for historical and cultural reasons, rather than because they have been demonstrated to be scientifically valid. For example, many regulatory officials feel more comfortable with animal data, and some even believe that animal tests are inherently valid simply because they are conducted in animals." As well as in vitro tests and computational modelling, the next extract emphasises the importance of the epidemiologists in accurately identifying human teratogens. Lastly, we will end this piece by hearing from Mat Fraser, who himself has suffered from the inability to identify human teratogens.
These drugs aren't tested on pregnant women, are they?
No.
By the drug companies. So.
No, it's obviously extremely difficult to do the type of testing that we would need to provide the information that we're looking for ethical reasons. So there's often a dearth of information on the effects of drugs and particularly chemicals in human pregnancy. There may be information about what the effects are from animal studies, but they don't necessarily reflect what's going to happen in humans. So in terms of the information that we have available to us, there is the world literature, of course. We also collect outcome data from pregnancies that we've been informed about. So if you as a GP were to contact us about a woman who had been prescribed a medication during pregnancy to seek our advice, we would provide our advice, and then at the end of the pregnancy we would come back to you and ask you what the outcome of that pregnancy was. And in that way we collect data gradually over a period of years. We collect more experience about use of particular drugs in pregnancy, and in this way we build a database, and we now have outcomes of more than 10,000 pregnancies logged in this way, and that helps us to provide more information to the next inquiry down the line.
And are you sharing that database with organisations like yourself in other countries?
Yes, there are information centres like ours in the UK, in other countries around the world. There is a European network of teratology information services, and if we need larger data sets, and we often do, combining with their data is very useful.
Dr. Simon Thomas talking to me in Newcastle. Although neither the Teratology or Poisons Information Service can be accessed by the public, you can obtain some of the information they contain via NHS Direct or NHS 24 if you live in Scotland. Over a quarter of the calls to the Newcastle team come in via these organisations.
After more and more children started to be born like me, thalidomide was tested on many different species of animals, almost none of which suffered the side effects shown in humans. Eventually, researchers discovered that New Zealand white rabbits also gave birth to malformed offspring, but only when enormous doses of the drug were used. The bottom line is this: more animal testing would not have prevented the release of thalidomide, because the scientists would not have found the side effects. Even if New Zealand white rabbits had been tested, thalidomide would still have come to market, because a vast majority of the species showed no ill effect from the drug. It amazes me that some people claim that more animal tests would have averted the disaster. The highly respected Office of Health Economics concluded that it is unlikely that specific testing in pregnant animals would have given the necessary warning. The right species would probably never have been used. Furthermore, Dr. John Shardine, an expert in birth defects, commented that in over 50 strains and species in which thalidomide has been tested, including even armadillos, birth defects have only been induced occasionally. So basically, if scientists were seeking to approve thalidomide as a new drug today, the weight of evidence from animal tests would indicate that it should be safe to be used in humans. The thalidomide tragedy happened over 40 years ago. But what have we learned since then? Has science moved on? Can we be sure that a similar tragedy won't happen again? I think that there should be tests to identify such dangerous drugs and chemicals. But which tests are up to the job?